If you find yourself bone-tired and dragging through the day after day, it may not just be the winter doldrum. You may have been infected with COVID-19. Severe fatigue is one of the most common initial symptoms of COVID, and in some people, it's one of the last to resolve, lasting. In the past week, two celebrities have spotlighted the condition. Jayson Tatum of the Boston Celtics said he was experiencing fatigue on the court after his bout with COVID-19, and actress Gwyneth Paltrow said she had been fatigued ever since contracting the virus. Breathe on, and to ensure your health and the health of others, don't miss these sure signs you've already had coronavirus. Some COVID sufferers do not get back to normal, says Fauci. There is no question that there are a considerable number of individuals who have a post-viral syndrome that really in many respects can incapacitate them for weeks and weeks following the so-called recovery and clearing of the virus, said Dr. Anthony Fauci, the nation's top infectious disease expert, during an International AIDS Society COVID-19 press conference last year. He added, "You can see people who've recovered who really do not get back to normal, that they have things that are highly suggestive of myalgic encephalomyelitis and chronic fatigue syndrome, brain fog, fatigue and difficulty in." So this is something we really need to seriously look at, because it very well might be a post-viral syndrome associated with COVID-19. Related, 7 tips you must follow to avoid COVID, say doctors. Fatigue caused by body's reaction to virus. One study done by Trinity College Dublin found that 53% of people with COVID felt fatigue 10 weeks after their initial. And according to the Long Hauler Symptom Survey, 100% of COVID patients reported fatigue that lasted after their illness. Fatigue is caused by the immune system's reaction to a virus. About 75 to 80% of chronic fatigue syndrome cases are post-viral in nature. VanNess, Department Chair of Health and Exercise Science at the University of the Pacific, told the viral infection and following immune response are precipitating causes for long-term symptoms. If you're experiencing post-COVID fatigue, it's important to rest and recognize your limits. Eliminate physical stress, learn pacing and energy management methods, educate family members about the illness and intervene in a systematic way, said VanNess. Related, 5 sure ways to avoid COVID now. According to a doctor, how to survive this pandemic is for yourself. Do everything you can to prevent getting and spreading COVID-19 in the first place. Wear a face mask. Get tested if you think you have coronavirus. Avoid crowds and bars and house parties. Practice social distancing. Only run essential errands. Wash your hands regularly. Disinfect frequently touched surfaces. And to get through this pandemic at your healthiest, don't miss these 35 places you're most likely to catch COVID.